Vice Admiral Adams here, and really glad to see all these smiling faces on.
Dr. Adams, we are just overjoyed that you would take time out of your busy day to join us here in Jefferson Parish. It really is so honored to have you. I guess we'll get started. For those of you that are on, Parish President Cynthia Lee Shang. I see a council member, Jennifer Van Rankin, joined us. I don't see everybody, but I recognize a lot of faces, and really it is such an honor that Dr. Adams, our nation's doctor, our Surgeon General, would join us today. I want to thank all of our faith-based leaders. Dr. Adams, in Jefferson Parish, we are a people of faith, and we really have strong leadership throughout our parish. Especially this year, we have seen them. Their partnership with us. They have hosted COVID testing sites. They have been involved with food drives, with virtual services to keep everybody safe. Certainly, they have had to do more than their share of comfort for this year with grieving families and with the mental health issues that these difficult times have brought. So they have been very busy. I also want to, before I formally introduce the Surgeon General, I want to thank Stephanie Rapaski, who's the local coordinator for our convalescent plasma operation, Warp Speed, as well as on our staff here in Jefferson Parish, Addie Emsice. She's our Chief Administrative Assistant involved in innovation and strategic initiatives. Addie is also a registered nurse and has a Master of Public Health. So she has really been on the forefront of us managing this coronavirus this year, working with our Emergency Operations Center. So without Stephanie and Addie, we really wouldn't be meeting here today. And with that, it is my true honor to introduce our Surgeon General of the United States, Dr. Jerome Adams. He is our 20th Surgeon General. He is what we call our nation's doctor. Dr. Adams has a bachelor's degree in biochemistry and psychology from the University of Maryland in Baltimore County. He has a Master of Public Health from the University of California at Berkeley, and he received his medical degree from Indiana University School of Medicine. Dr. Adams oversees over 6,000 health officers in nearly 800 locations worldwide, and he has been so very proactive on so many issues, including coronavirus. I can still, Dr. Adams, remember how you were teaching our country how to even quickly make masks out of T-shirts, and that video I watched so many times. It was so very important at that time. But he's been on the forefront of fighting the opioid epidemic, smoking cessation, as well as oral health. And certainly this year has been a year like no other for our nation's doctor. But I want to say personally, Dr. Adams, we were able, our first case in Louisiana was March 9th, and that was a Jefferson Parish case. And on March 12th, I was invited to the governor's meeting in Baton Rouge. And for us local officials to actually be there with you, I guess you knew this was going to be a high area at the time, and you were right here in Baton Rouge in our state's capital to hear from you directly about, we didn't know at that time the unimaginable situations we would find ourselves in the next couple months, but it was very important as a local official that I was able to hear directly from you and be in the room with you as we were just on the verge of this thing really rising in our community. So we are very honored to have you on this very important issue. Thank you for your service this year. It has been, like I said, a year like no other. I'm sure you've been one of the busiest people in our country. So with that, welcome to Jefferson Parish and welcome to our wonderful community of faith-based leaders. And we're happy to have you with us.
Well, I just really appreciate, let me make sure I'm unmuted. I just really appreciate the opportunity to be with you all. I love the people of Louisiana. My grandmother lived there for about 15, 20 years, and we go down and visit her in Monroe quite frequently. And I know how important faith is to all of you. It's a big part of the reason that I have throughout my career really tried to emphasize and strengthen those relationships between health and the faith community. Because we know that you all are the ones that have been taking care of the social determinants of health long before we ever called them the social determinants of health. Making sure people have food to eat and a place to lay their heads at night. Making sure you're taking care of all those pre-existing vital conditions that actually lead to the pre-existing medical conditions that are causing people to suffer disproportionately in communities like Jefferson Parish. And as you mentioned, The number of COVID-19 cases is rising rapidly across the nation, and Jefferson Parish has experienced more COVID-19 infections than any other single parish in Louisiana, unfortunately. These statistics are alarming, but you and your congregations can play a role in changing this trajectory and helping those currently combating the disease. I often say I would rather have the local pastor or rabbi or imam out there telling someone to go get their blood pressure checked or to wear a mask or to donate convalescent plasma than to have the Surgeon General of the United States, because they are more likely to listen to their faith leaders. And it's why we've got to work in partnership. And as some of you know, Operation Warp Speed is a partnership between government agencies and private firms in an effort to confront the enormous public health challenges of COVID-19. You're probably familiar with the vaccine and testing efforts under Operation Warp Speed, but a third focus is development of therapeutics to treat COVID-19. This includes the collection of COVID convalescent plasma, which we call CCP. So let's take a really quick dive into CCP, starting with what is plasma. Well, plasma is the fluid that suspends blood cells and carries them around the body. And it contains proteins, salts, nutrients. When that's collected from patients who have recovered from coronavirus, it is known as COVID-19 convalescent plasma, or CCP. COVID-19 patients develop antibodies, proteins developed by their immune system to help fight infections, which then circulate in the blood plasma for a period of time after you've recovered from the virus. And that's the way it works for most any virus. Your body gets the virus, it develops antibodies to it. Those antibodies circulate in the plasma for a certain period of time. And that happens also with COVID. The use of convalescent plasma, rich in antibodies to treat or prevent serious infections, has been a part of medical practice for more than 100 years. And other than remdesivir, COVID convalescent plasma is the only treatment for hospitalized patients that is approved by the FDA under an emergency use authorization. For many months, Operation Warp Speed has been working across the country to increase collection of CCP for both local and national use. And you probably didn't have any of these in Jefferson Parish, but there were big billboards of me in Times Square in New York City telling people to donate their plasma. And we've been really focusing on this as a way that people can give back. We know that there are concerns, and rightly so, among members of a number of communities, particularly communities of color, about having something done to them. And we've really got to work to overcome vaccine hesitancy and promote vaccine confidence. But one of the things I want to emphasize is convalescent plasma isn't something being done to you. It's something that you have in your body that you can give to help your communities. It really fits in with the concept of us all being there for one another, supporting one another. With our partners and stakeholders such as yourselves, we've been able to triple national collection volume since the beginning of June and have a goal of quadrupling collections by the end of this month. Current demand for CCP continues to increase, though, due to increasing rates of infection and hospitalization. As the number of cases go up, the need goes up. And there's also a significant demand for regular blood donations to meet patients' needs. Those have dipped down, unfortunately, because we know that a lot of the collections of blood happen at places that are closed down because of COVID-19. College campuses, nursing homes, places or senior centers. We know that this is something that can save people's lives, but unfortunately COVID, as it has a way of doing, has found multiple ways of trying to harm our health, and that's why we need you. In your region, there are multiple collection agencies such as the Blood Center, East Jefferson General Hospital, Ochsner Health, Octapharma Plasma, and CSL Plasma. So this means there are convenient locations for donation and collection for everyone who is able to and willing to participate. But we need you to let the community know about the need for CCP donors and how they can make a difference. Because a trusted voice can truly be the difference between finding and activating donors or letting people go without a potential life-saving treatment. Collecting convalescent plasma is similar to the process of donating blood. It doesn't involve receiving any type of treatment or vaccine. The difference is that in plasma donation, only the plasma is collected. The donor's red and white cells and platelets are all returned to the person before the procedure is completed. So the good news is you're less likely to feel weak or tired following a plasma donation than a regular blood donation. We need to help people understand collection centers are following stringent guidelines for safety, sanitation, and social distancing, ensuring protection of donors during the process. I'm asking each of you to help get this information out to your organizations, spread the word about CCP, encourage donorship. We've created flyers, brochures, and social media posts as part of a national advertising campaign, and we encourage you to use and distribute them among your networks and communities. Anyone interested in donating can go to www.thefightisinuS.org to find the closest donation center and even get ride assistance from Uber if needed. Dr. Tim Peterson is the Chief Medical Officer with the Blood Center in this parish, and he's here to provide us with an overview of the collection process and explain what to expect, and then we'll open it up for some brief questions. But I know we've all witnessed a lot of sadness this past year, but we've also seen how strong we can be when we work together. You often hear that you'll see the worst of humanity in tough times, but I think you also see the best of humanity during tough times. And that's why I'm not a bit surprised when, even in the midst of a pandemic, I'm often asked how someone can contribute and safely make a difference. And donating plasma, if you're someone who's recovered from COVID-19, is a great and safe way to help today. So I want to end by saying you are the trusted voices in the community. I guarantee you more people want to hear from you as faith leaders than even from me as the Surgeon General. So please remind people that we are so close, weeks away from beginning to vaccinate people. But we need them to just hang on a little bit longer. They're tired, but washing your hands, wearing a mask, and watching your distance will help us get to a place where we can get the vulnerable vaccinated, get everyone else vaccinated in this pandemic. And the keys for this Thanksgiving are small and smart. Go to cdc.gov to figure out how to celebrate safely this Thanksgiving. Keep it small so that we can have as many people around next year for a big celebration. And understand that the vaccine will prevent people from getting disease, but there will still be people who continue to get this disease. And that's why we need to have more and more convalescent plasma out there available for those individuals. Again, I want to have the biggest, the most Louisiana-like. I want to have Mardi Gras next Thanksgiving, and I want it to be because we've all done our part to make sure as many people as possible live through this terrible, this tragic time. And we've got the tools. We've got the science now, which is different than March and April. We have the tools to do it. We just need a fourth W. I talked about my 3 Ws, washing your hands, wearing a mask, and watching your distance. But we need the will to also be able to do the things that will that have been shown to be effective and get us there. So with that, I will turn it over, and then we will have questions after we hear from Dr. Tim Peterson.
Thank you, Dr. Adams. This is Tim Peterson from the Blood Center. I'm medical director here, also at East Jefferson Hospital, Tulane University, and LifeShare Blood Center out of Shreveport. So I cover about 80% of Louisiana. As Dr. Adams was saying, the process for plasma is not very different from whole blood, other than that you pretty much do not leave feeling weak. Again, all of your blood, red cells, white cells, and platelets are returned to you, along with a significant amount of your own plasma, and a little bit of replacement fluid is given, and most donors, their bodies don't even know they've had a problem. The thing that is different with convalescent plasma as it concerns blood centers is that to the Food and Drug Administration, which regulates everything associated with blood collection, this is just a plasma product. That means anyone who comes in to donate, besides having a history of documented COVID infection, has to meet all regular donation guidelines. And all of those guidelines are available on our website, thebloodcenter.org, or you can visit the Food and Drug Administration website. It's a little more in-depth. But essentially, As a product, this is considered fresh frozen plasma. And it is only the fact that it contains antibodies directed against portions of the COVID virus that make it unique and different. But with any blood component, we're required to follow all of the guidelines laid out by the FDA, including extensive testing to assure that this is a safe and efficient product. With that, we are going to be doing additional testing on these products to verify the amount of antibodies that are present. And that gives a little bit of idea to the doctors as to the effectiveness of the blood that's going to be provided, the plasma. But again, we really need everyone's help to get the word out. As Dr. Adams mentioned, probably the largest portion of our donor collection comes from high schools and colleges. That's about 25 to 30% in our region, and we no longer have the ability to go and collect there. And that's pretty much across the United States that way. Don't ever let anyone tell you the young people don't do their job. They are wonderful donors. And when they start early, they generally become lifetime donors. Data shows, though, that only about 5% of eligible donors, eligible adults who can donate, actually do donate. And what we found is most people will say, I didn't donate because no one ever asked me, or no one ever, informed me of the need. So your help is crucial in getting the word out that, I tell people, an hour of your time, that's really what we're asking when we ask you to come in to be a blood donor of any type. But you're providing a lifetime to the patient who receives that product. And there's very few things we can do where a little bit can make a lifetime difference. As Dr. Adams mentioned, we are having an extremely critical need for all blood donations, not just convalescent plasma. Dr. Adams, in our area, we happen to be having a fairly stable, low infection rate. I am shipping very little convalescent plasma for use in our region. Most of it is being collected to help other areas that are spiking enormously. And that's through the efforts of the community and our governmental agencies in getting the word out for proper safety precautions with this virus. But we are experiencing severe shortages of whole blood and red blood cells made from that whole blood. Most people don't realize October, November, December, that's when everyone goes and has their elective procedures done. Let's wait until the end of the year. Between the holidays, you get that knee replacement or they get that hip replacement. Because, January 1st means another deductible and nobody wants that. So the need has skyrocketed in the last couple of weeks, especially as hospitals have tried to make up lost patient care that occurred, especially from March through August. So we really need your help. If someone can come in and be a convalescent plasma donor, they're able to provide 3 and 4 doses of plasma, depending upon their size. But if they're not a convalescent plasma, we need them as much or if not more, just to be a regular whole blood donor. And we ask them, try to be a donor and try to be a regular donor, because the blood that's donated today is the one that will be used for the patient tomorrow. Do y'all have any questions for us?
Thank you all very much. So this is where we will ask everyone, if you have any questions, you can either chat, type into the chat box, or preferably unmute yourself. We'll see the light come off, and then we can ask questions either for the blood bank or for the Surgeon General.
Very good question. What is the expiration for plasma? Fresh frozen plasma is collected from whole blood or from apheresis machines, as Dr. Adams mentioned, and if kept at minus 18 degrees or less Celsius, it's good for 1 year. So we currently have plasma that's collected that's been up to a year old, and it works perfectly fine. The only thing is, once it is thawed, we have to thaw it in a blood warmer so it's not readily available immediately. It's only good for 24 hours. So when the doctors need it, they put in a request, we get it. If it's not used, it has to be discarded. So they're very judicious in the use of plasma. I guess I could have told you while we're waiting for questions. The plasma donation process, whole blood from start to finish with the donor questionnaire and the checkings of the mini physical and vitals, probably 45 minutes to an hour. The plasma collection, you're probably going to add about another 30 minutes or so. The actual collection takes about 40 minutes.
About 40 minutes.
About 40 minutes to actually collect. It's a single needle. Goes in the machine. It's a big centrifuge. It spins it down, collects the plasma. Most of the donors take a picture of their plasma while it's collecting. It's kind of interesting for them. And so it's about probably an hour and a half total from start to walking out the door with the T-shirt and cookies after we've used a railroad spike to collect blood. No, it's not that big, but so it's a very, very efficient process.
Dr. Peterson, can you just highlight the safety precautions that you all are taking? Because that could be a concern that people have. I think that's important for people to really know that you all are going all out to make it as safe as possible. And then are you doing, you're doing everything by appointment. And so helping people understand what that looks like.
Currently, we ask donors to, if they'd like to come in, to make an appointment through our website, thebloodcenter.org. When they make an appointment, if they are donating on the same day that they have made the appointment, they can complete the donor questionnaire online. So they don't have to be face-to-face or in the same area with one of our staff that are collecting. If they do that, that also takes off about 20 minutes or more when they come in. So they would come in, they would have their paperwork or their phone with a barcode. That would pull up the donor's questionnaire, make sure that it's correctly or appropriately answered by our staff. And then they would go in and have a very short mini physical, blood pressure, temperature, arm inspection, just to make sure that everything is in good shape per FDA guidelines. Of course, all of our staff are temperature checked every morning at work and every time they come in. Also, all the donors' temperatures are checked when they are part of the mini physical, so that's checked. Staff, of course, are masked when they are collecting the blood. They are separated from other donors. We have decreased the amount of beds in our locations so that there's a sufficient physical distancing between donors. The donors, again, are asked not to congregate in an area. That's why we have appointments. And between each donor, all of the donor beds and all the donor equipment are wiped down with antiviral, antibiotic type wipes. Of course, hand cleaning, hand washing, that's all part of our regular blood collection facilities. And gloving.
Yeah.
And of course, our staff have gloves available for donors, or our staff will always have them available too. So whatever makes the donor comfortable, we're ready to make sure that they feel good.
We also require that the donors wear a mask.
Yes, donors are wearing.
When they come into our facility, they must be masked, or we won't allow them in the door.
Have you all seen the other questions that popped up too?
No, we haven't.
Can people who recovered donate multiple times? Yes, absolutely. My sister-in-law actually was diagnosed and she's donated 4 times already. She got it early on in the pandemic. And then I'll leave this one to the subject matter experts. For those who have not been tested for COVID-19, do you also test for antibodies, or what does that look like if you don't know that you've actually been diagnosed with or recovered from COVID-19?
We are allowed by the FDA to use a screening antibody test for donors who have no history of having had COVID or have no signs or symptoms at any point. If the original screening test were to come up repeat reactive, we then would do a secondary test to verify the first test was reactive for antibodies, and then to also quantitate how much, or what the level of antibodies are in that product. We then notify the donor, of course. In our region, as of October, we were having approximately 11% of blood donors who gave no history of COVID or having been exposed had antibodies to COVID identified. Those donors, of course, were recruited to become hopefully convalescent. But even if they just did whole blood, we would still be able to produce 1 dose of convalescent plasma from a whole blood donation while having red blood cells for needed surgeries. So yes, we are testing the donors. We're not allowed to use that as a recruitment tool. We would ask not to do that because, again, it's not one of the required tests by the FDA, but we can use it in the search for convalescent donors.
There seems to be one question that got hidden at the top, which speaks about the severity of the case or the symptoms, and if that's related to the antibody reaction.
Data suggests that it is. Someone who comes in and seems to have had a more aggressive case of COVID, when they recover, and you're allowed to collect after someone is feeling completely normal for at least 14 days, the earlier the collection, the higher the levels of antibody appear to be in the product. And the worse the case, when the patient recovers, the antibody levels also appear to be higher. However, it comes down to, it's not always the amount of antibodies at present. It's the affinity of the antibody for the virus in the patient that received the product. Some viruses produce antibodies that just are stronger and attack the virus better, and they may not be in high levels, whereas others may have high levels of an antibody, but they have no effect on a virus. Example is hepatitis C. People make strong antibodies to hepatitis C, and it does nothing for the prevention of the disease. So, but right now it is believed that higher levels and closer collections to a person with a stronger case probably have some increased benefit.
There was another question from Mr. Willie Green. Since vaccines are going to become available early next year, why is plasma donation important at this time? And I'll just reiterate that there's prevention and then there's treatment. So we give people a flu vaccine to prevent them from getting the flu, but there's still going to be a certain number of people who get the flu, and we still want to make sure we've got hospital beds and Tamiflu and other medications out there available for them when they get the flu, so that we lessen the chance that they'll end up in the hospital. We lessen the chance that they'll end up dying or having severe complications from the flu. So let's use that in the context of COVID. We will have vaccinations for COVID in the next several weeks. We're going to start vaccinating the vulnerable. That is a great thing. But that said, no matter how good of a job we do, there are still going to be people out there who don't get vaccinated and end up with COVID. And so we need to make sure we have treatments available for them so that we can help treat them after they become infected with COVID. We actually anticipate that with record numbers of cases that we've seen across the nation over the last several weeks, that in 3 to 4 weeks, we're going to have a whole lot of people out there who need to be treated for COVID, and the vaccine is not going to help them. Even if we had a vaccine at that point, it's not going to help them because they've already got COVID, and now they're sick, and they need convalescent plasma, remdesivir, other treatments. So it's a 1-2 that we have in terms of prevention and treatment. And it's incredibly important that we continue to have convalescent plasma available, especially as we go into this winter season where we're going to expect to see more cases, especially with, let's face it, even though we're telling people to celebrate small and to celebrate smart, we know we're going to have a surge after Thanksgiving. We've had a surge after every single holiday so far this year. So now it's critical that we have as much convalescent plasma as possible to be able to treat these individuals so that we can get through to the other side of a vaccine and get that herd immunity that will allow us to put this pandemic to bed for good. So great question, Mr. Green.
Certainly, plasma is not only going to be used for direct patient transfusion, but a lot of convalescent plasma is going to be used to produce what we call hyperimmune globulin, a super concentrated dose of plasma antibodies that can be injected to a patient if they are recently exposed or they have a worst case. So you'd be kind of getting a supercharged dose of antibodies concentrated. So a lot of plasma is being collected for that also. And that's another arm in the fight against the virus.
That's a great point. Exactly. There are many different ways that your plasma donation can help out in the response against COVID-19. And no matter, I mean, the flu, 50% of adults get vaccinated for the flu every single year. We hope, we pray, we're asking you to help us push those numbers as high as possible for a COVID vaccine when it comes out. But we still know it's not going to be 100%. There are going to be people out there who continue to get infected with this virus, and we need to really have every tool possible available to help them recover. And that starts with convalescent plasma, but it also are other drugs derived from convalescent plasma and other therapeutics that have been shown to really decrease the chances that people will have severe complications and die.
There's also something I really need to bring up to everyone here. And we've talking about the need for regular blood donations, but this could be severely affected with the rollout of the vaccination protocols that are coming out. Currently, all the vaccinations that are available are still listed as experimental. And under FDA guidelines, if someone receives an experimental vaccine, they're deferred from whole blood or any volunteer blood donation currently for a minimum of 1 year. That is having a dramatic effect on our donations because people are getting vaccinated. Now, we anticipate the FDA will allow us some leeway with this depending upon the type of vaccination that is produced and whether it's a live attenuated or it is a recombinant or manufactured RNA virus. Based on that, we're hopeful that if someone is vaccinated in one of the clinical trials, that they will be allowed to donate anywhere from immediately to 2 to 4 weeks after the vaccination. But as of right now, it is still a deferral required by the FDA for anyone vaccinating. And there are large groups of vaccinated people out there participating. And we are seeing in our area alone significant loss of blood donors at this time because they're participating in the unknown study. We don't know what antibodies may be produced yet. We don't know what effect they may have. And of course, who gets blood products? Sick patients. So we have to always be aware of what could happen down the road. But we're very hopeful, and we know the FDA will provide us with the information on that.
And we're on that. And I've got to run, but the one other thing that I would highlight to all of you as faith leaders is, and this is going off script a little bit, but this will be, I've often said, our most important flu vaccination season of a generation. Why do I say that? Well, number one, hospitals are already starting to be overfilled, and we can't afford to have individuals with flu taking up beds that could be used for people with COVID-19. 500,000 people in this country every year are hospitalized for the flu. 40 to 60,000 people die every year in this country from the flu. We can't afford to have that extra burden on our healthcare facilities so far this year. That's number one. Number two, the symptoms of the flu are the same as the symptoms for COVID. So I know by now all of you have been into a building where they ask you, have you had any of these symptoms in the last 14 days? Well, if you have a mild case of the flu, or you're going to say yes, or you may even have a mild fever, and that's going to cause you to get sent home from work, your kids to get sent home from school. It's going to have places shutting down. It's going to wreak havoc on our society if we've got a bunch of people going around with preventable flu. We also know it's an opportunity to have that conversation and to prime that pump for a COVID-19 vaccine, which again would be a real shame if we had a vaccine and it actually worsened disparities because people wouldn't get the vaccine for an array of reasons. Finally, we know that the people who tend not to get vaccinated are people of color and people from impoverished communities. I personally, and I hope this doesn't offend anyone, but I think that we should be just as alarmed about the disparities in flu vaccinations as we are about people dying at the hands of law enforcement officers. And I mean that purely from a statistical standpoint. 300 Black and brown people die at the hands of law enforcement officers every year. And I was just as traumatized watching what happened to George Floyd as anyone else was as a Black man. 40 to 60,000 people die of the flu every single year, disproportionately Black and brown. People are out there preying on Black and brown communities with misinformation that is causing them not to get a safe, effective treatment out there or preventative measure out there that could save thousands, tens of thousands of lives. And I think we need to consider that a social justice issue. I think we need to go out there and promote flu vaccinations because that will save thousands, if not tens of thousands of lives this year and moving forward. It's not too late to get your flu vaccine. The data that we have so far this year suggests that African Americans are actually being vaccinated for the flu at lower rates this year than they were last year. Lower rates. That's even though we have record numbers of people being vaccinated for the flu. So right now you're seeing disparities worsen for the flu, not go in the direction that we would want them to go into. There's really easy things that you can encourage people to do to stay safe. Wash your hands, wear your mask, watch your distance, get your flu shot. If you've recovered, donate convalescent plasma. These are ways that everyone can do their part to help us get over this pandemic and to help create a healthier society. So I just want to say thank you to everyone who's on this call. Thank you for your support of me and my office, and know that you've got someone, at least one person, and I contend that there's several, but at least one person out here who's going to go to bat for you all, because if I don't, then my mother and her family are going to come after me. So know that I have a personal interest in making sure you all do well there in Jefferson Parish. And you only need to reach out if there's anything I can ever do. I truly mean that. Thank you.
Dr. Adams, thank you so much for your time. We know how precious it is. And, you know, to all of our faith-based leaders, you heard what the Surgeon General said about Thanksgiving. He called it small and smart. So please get that out to your congregation, because we have a little bit of a danger zone ahead of us in a couple of days. So let's make him proud of our efforts. Thank you so much, Dr. Adams.
Thank you.
Thank you all for being on. Thank you.